Hello, good afternoon. Welcome to the talk session with Yusrin again. Today we'll be talking about eczema as well, but today we'll be focusing a bit more on scratching in eczema and what we can do to stop the scratching. Right. Again, my name is Dr. Vincent. I'm from Lifestyle Clinic in Bangsa South. We'll start again by the discussion on the topic per se, and then later on, after about 20-30 minutes, we'll start taking some questions. All of you that is following can post questions on Facebook as well. We'll take as many questions as we can, and each of you that has posted a question or took active part in the interactive section with us today will receive a Eucerin soothing cream that is worth 65 ringgit. This is the free gift that Eucerin is giving away. So don't miss the opportunity. Just feel free to drop me a question anytime during this hour, right? Okay, without any delay, we'll go into the discussion for the day. Atopic eczema, as I mentioned a few times in the past discussions, that is a type of inflammation skin disorder that is associated with our own body immune system. Atopic eczema is actually currently very common in Malaysia. It's estimated about every 1 in about 5 or 2 in about 10 children in Malaysia actually has atopic eczema. Eczema is a genetically linked condition, as we've mentioned before previously as well. But it also is influenced by the interaction with the surrounding environment, in the sense that where there are certain triggers that can help make the eczema worse, right? A little bit more on childhood eczema. One of the cardinal symptoms of childhood eczema is itching, meaning one of the first things that parents notice about eczema in childhood is itchy skin, whereby the child starts scratching here and there, and they develop a red patch of rash, commonly over the flexure areas. Flexures means the areas like the elbow flexures, the necklines, the knee, the back of the knee. Those are the typical areas where it starts to appear. And usually scratching is one of the first and also most difficult symptoms for parents to control. Later on, we'll discuss a bit further about how we can actually help a little bit on reducing the itch. And since we were talking about parents and all, it is very important where the parents and the child of atopic eczema gets proper education regarding the disease itself, because as we know, it's a genetically linked condition. It will follow the child a whole lifetime, but there are things that we can do to improve this condition, to control it so that the patient don't feel the problem from the eczema. As I said, in atopic eczema, patients tend to be born with a natural tendency of getting drier skin. As the skin becomes drier, it also becomes more sensitive, and dry sensitive skins make patient skin even more prone to problems when exposed to allergens. One of the first steps the parents must do is learning how to recognize that the itch is a problem and get a doctor's consultation early. Whereby, let's say any parents that sees the child start scratching here and there very early in their life, and is recurrent or is associated with a red rash, it is best to get an early medical consultation to confirm the diagnosis. So it is important that parents get a confirmed diagnosis before assuming that all itches are eczema. Yes, it can be something else. So it is important that we need to know which is which. As I've mentioned earlier today, one of the worst symptoms that patients can feel in any form of illness is actually itchy skin. In pain, let's say for example, we take a patient who has pain, there is actually proper medication to just take and the pain will go away. But when it comes to itch, it is slightly more complicated than that. The natural tendency for a patient when the skin itches is to scratch. When they scratch, they start feeling better. But in a way, actually, the scratching actually over the long term makes it worse. Why is it so? Because when the skin itches and the patient scratches, it actually induces it triggers a response whereby there are some chemical mediators that are released, what we call the histamines and all, that actually makes the cycle even worse. In another word, what I'm trying to say is that if the skin is itchy, you scratch it, yes, temporarily you feel better, but over the long run, you feel worse because it's a cycle that you're potentiating. You're not trying to stop it, but when you scratch, you release more histamines, so it makes it worse. So scratching is a big no-no in eczema, but I can understand that it is easier said than done. So let us go through this session and see what else we can do to advise patients to help them reduce the scratching. Most of the time, when patients scratch, not only they potentiate this cycle that makes the itching worse, they also cause damage to the skin itself, whereby they can cause severe scratch marks, where we call them medically as excoriations. And these scratch marks actually breach the skin protection even further and can increase the risk of skin infection to secondary bacterial or even virus infection. Right? Continuous scratching can even lead to bleeding, which is also a problem for not only child but adult as well. And if there is bleeding and if there is trauma to the skin, when the skin heals, there is always a potential of forming a scar, which is something that we do not want as well, because scars, as we know, all scars are very, very hard to treat. One of the easiest ways that most of us doctors advise the parents or the child to reduce to reduce the effect of skin damage is by keeping short fingernails. So in that way, even when patients scratch, they do not cause as much damage as they do when the fingernails are kept long. Apart from scratching, we can also actually help advise patient to do light massage on the area, or maybe apply suitable moisturizer instead of scratching. Instead of scratching it like this, they can go around just massaging it like this. So at least in a way, patients do not damage the skin and yet does not potentiate the cycle even further. It is here also that I like to point out that there is no magic medicine that can help reduce itching. But of course, if the itch is very severe, short-term antihistamines, oral antihistamines can be used to reduce the sensation of itch. Topical corticosteroids can also be used locally to control the inflammation of the disease, so that the patient feels less itchy and less need to scratch. However, the most important of all, as I've already stressed out over the last couple of weeks, is to keep the skin healthy even before the rash start. Going back to earlier today in our talk, I've mentioned that eczema leaves the patient with natural tendency of getting dry skin, and this will stay with patient for life. Hence, for life, patient needs to do something to replace this moisture in the skin, so that they can get very, very good control of the illness, and they do not get any and can reduce the flares of the eczema illness. How can we do it then? The most important one is getting a good medicated, clinically tested skin moisturizer, as like those provided by Eucerin. There are also others in the market. Make sure it's clinically tested and it's clinically proven. And also, a lot of times, some moisturizers, they contain irritants instead, because they have natural, preservatives, or even they have added scent to it that can actually be counterproductive. Hence, parents and also children, they need to know which are the best one to go for without buying the wrong product. After keeping the skin moisturized, it is also very important that we try and keep good skin hygiene for the patient, for the child or the patient per se, because good skin hygiene, when the skin is kept clean and moist, eczema symptoms are less likely to occur. Of course, we do not advise patients to completely avoid sports and sweat. Example, it is quite impossible if you ask as like a 7 or 8 year old or maybe a 5 year old to remain inactive so that they don't sweat in Malaysia. So it is down to the parents again that when we see patients do sweat, we try and dry up the sweat as soon as possible, keep the clean moist, because sweat over long term is also a return to the skin. And in Malaysia, it's also a very hot country. It is good to always wear loose clothing so that there's always the cooling effect there, and it doesn't cause even more sweating. So again, before right now, I would like to again reinforce a few tips on how to take care of the skin for patients with eczema to reduce the itch. As parents and caregivers, we can actually minimize the patient to eczema triggers. What are the triggers likely to be? It can range from common household items like harsh soaps, detergents, perfumes, even prolonged exposure to hot and humid environment. Even sudden change in temperature can trigger eczema. So we must be very diligent to look out for any trigger factors. Avoiding trigger factors sometimes can mean a lot to a patient in sense of controlling the illness. So this is actually very important for the parents to pay attention. I've also stressed out too that it is good to help dress patient in a loose-fitting, soft clothing so that they always feel cool and comfortable in our country, right? That is point number 2. Point number 3, how to take care of how tips for skincare will be as our children grow older, we can actually teach them methods on how to keep their skin moist and clean by maybe adjusting a little bit of the lifestyle, but not say totally changing the lifestyle. Example, that when they start sweating, they know when to go and clean up early and keep the skin healthy, right? Other than that, there's one more that we can do is prevent scratching prevent trauma from scratching, keeping the fingernails short. Let's say there are some things that we can also do for very, very severe eczema patients, but those are usually prescribed by doctors, whereby we call it RAPs, maybe the localized area that is very affected, or the rash is very active, the itch is definitely very severe. Sometimes we opt to wrap up the area to prevent scratching, but I would not advise parents to do this at home without proper medical advice, as it can lead to some complication. Finally, a few more general points that I would like to point out before I finish. Eczema is a lifelong condition. There is no known cure for eczema, but parents should be reassured that we can control the illness well without and improve the quality of life for your child as much as possible. It is possible for children to live a normal life even if they have eczema. Skin in your child who has eczema has a tendency to be very dry. Moisturizer is very, very important. I would like to stress out here that it is even more important than what some parents think are topical corticosteroid or even oral antihistamine. This is the first step that all parents need to do. Apply enough moisturizer on an eczema-prone skin. Okay. There is no magic bullet to cure eczema. Hence, some of us may find it frustrating in what to do, but I would also like to say, don't give up. If you need, always seek medical help. I'm sure there is a way how we can help every individual differently. And finally, maybe I leave you with this statement that we know that eczema improves, even though there is no permanent cure. It improves by the time the child reaches their teenage years. So about 65%, according to data, gets better when they reach to about 12 or 15 years old. So parents should be quite reassured by this fact as well. So I think that will be all on my talk today. Maybe we'll start taking some questions now. For every question that is posted, again, I would like to remind the audience that there will be a free gift given by Eucerin, which is a soothing cream that is worth about 65 ringgit, right? Just give me a moment. Let me take some questions. Okay. Miss Janice, she asked, how can I ensure that the itchiness do not come back so fast? I often scratch once a month at least. As I mentioned in my talk, what we can do to ensure itchiness do not come back fast is to get a good control of the eczema itself. First of all, we need a lot of moisturizer, which will help improve the skin health itself. We need proper medication to treat the flare up. Sometimes a lot of patients are non-compliant to their topical medication, as in once they start applying, over the next 2 days, they feel better. Even the doctor asks them to use it for a couple of weeks, they actually tend to stop. Without complete control of the rash per se, the tendency of it coming back becomes more. But if you tackle these two aspects, as in compliance to the topical agent, and also long-term moisturizer that will improve your skin health, eczema should be controlled quite well. And I also noted that you say you tend to scratch once in a month. Maybe it's also worth it for you to look into your lifestyle, as in, do you expose yourself to any possible triggers? Because let's say if you do, and no matter what you do, like you control you use your proper medication, you use your moisturizer, but if you still get exposed to those trigger agents, it can start back the itch cycle and potentiate the rash again. So in summary, what I would like to tell you is, look at your medication, use it properly and adequately as per advice. Use your moisturizer long term, get a good, proper medicated, clinically proven one. And 3, look for any potential trigger factors and avoid them, right? Okay, the next question will be from Miss Michelle. Is it okay to bathe with hot water if I have eczema? Sometimes heat actually can make the symptoms worse. If you find it so, try avoid the shower being too hot. Cool water tend to be more calming for any itch as well. So my answer is, if it's possible, try not to make the water too hot, right? The next question is from Janice again, I believe. When I grow older, will this become worse? I think what she meant is, when she grow older, will her eczema become worse? Okay, we know that, as I mentioned earlier, eczema improves when patients get to their teenage years. So if your eczema itself, I would anticipate better control, less recurrence, less flare up as you grow older. But of course, you have to remember the next point that I've said. Because eczema patient is born with a tendency of getting very dry skin, means lifelong the skin will be drier. So you need to prevent another condition from coming in that may be related to eczema in older years, whereby whereby the skins get drier and the itch gets worse. It is called, medically, I think it's called steatotic eczema. This can actually make the skin more itchy. The tendency for patient of eczema patient getting it is higher because they are born with natural tendency of getting dry skin in the first place. So that's why lifelong good topical moisturizer will help you prevent that, right? Question number 4 will be from Miss Carol. She asked, what is omega? Is it an ingredient that is good for eczema patient? I think what she meant to ask was, must be the what she meant to ask must be what is written on the eucerin soothing cream, the 12% omega. Actually, there are a few kind of omega oils: omega 3, omega 6, omega 9. Omega 3 actually has anti-inflammatory properties, be it taken orally and in this case applied locally. So what the cream try to do is add an element of anti-inflammation. So you get the benefits of it being a moisturizer. That means of it being a water replacement therapy, and also you get the added benefit of anti-inflammation. That means reduce the flare up of the illness itself. So in a way, it's a combination of what we say moisturizer and anti-inflammation. Is this an ingredient that is good for eczema patient? Well, if you get both water replacement property and also anti-inflammation agent in one cream, I would believe that yes, it will be very beneficial, and you should try it and see, right? We'll take another question. Just give a minute. John, this question is posted by Mr. John. Is applying body oil or lotion better for patient? Okay, let me think how to take this question. Okay, oil is also a kind of moisturizer, right? But I would like to say that we've come a long way from using oil alone. Even what we call the petroleum gel, the Vaseline is actually also a kind of moisturizer. How does it work? Actually, oil is a form of occlusive moisturizer in the sense that it forms, let's say if this is your skin, the oil forms a barrier on top of your skin, blocks off the perspiration. So perspiration is your skin losing water, right? That means it blocks off the perspiration and help retain the water. But like I say, we've come a long way from this in the sense that I think it will be very uncomfortable for a patient to be using oil and feeling oily the whole day through. And also long-term wise, for some patients, it can actually cause some certain skin irritation and cause some inflammation on the skin itself. So applying oil on the skin, I would not recommend. It's better with so many products around nowadays. Go find yourself a good one and stick to that, right? Although then the next part of question you asked is applying lotion better for patient. Like I just said, the lotion, or what we mean moisturizer, it will be beneficial provided that it has been clinically tested and clinically proven. We have some lotion that can be counterproductive in the sense that maybe it has too much perfume in it, or it may have too much preservative in it. Instead of helping patient in eczema, it makes the condition worse because it triggers the flare up. This is only true maybe in more sensitive eczema patients, but normal patients that do not have this tendency to get eczema flare up, if they were to use this perfume lotion, I would assume it's okay. But for eczema patient, I would definitely advise patient to be more careful in choosing a lotion. Choose the right one and you'll be fine. If you choose the wrong one, you can actually make the illness worse, right? I hope I've answered your question, John. Next question is Lisa, is posted by Miss Lisa. She asked, will eczema affect the hair scalp as well? Yes, eczema actually affects all skin areas of the body, with tendency to be focused more on the flexures. That means, let's say the neckline, the elbows, the armpits, and all, because these are the areas where we always, let's say, keep them flexed and it's opposed to each other, and it builds up sweat through perspiration. And we know that sweat and perspiration actually irritates the skin, and hence why they have a natural tendency for these areas. But of course, it can affect the scalp as well. We see a lot of patients patients with atopic eczema having secondary scalp problem because of the scalp being dry. But that's a totally different discussion. But if you have a severe itch on the hair, in the scalp area, please consult a medical doctor before deciding on using what type of medication or taking any medication orally. And of course, the interesting thing about scalp here is we do not use any lotion on the scalp, right? But of course, there are proper products there to help the scalp should the scalp need any moisturizer as well. Any improvement in the moisture of the scalp itself. So please consult a medical doctor, right? The next one will be from Miss Cheong. Can I use other cosmetics such as sunblock, whitening lotion if I have eczema? Okay, we'll talk about the first part of the question first, right? Ms. Cheong asked, can I use other cosmetics such as sunblock in eczema patient? Yes, you can use sunblock in eczema patient. Again, like I say, nowadays in market, there are so many different companies and so many consumer products available. So it is important that you choose a sunblock that does not contain any elements that will irritate your eczema skin. Then it should be beneficial for your skin, because we know that sun over the long term actually cause skin dryness and also cause skin aging, and this can potentiate illness in eczema. So a proper, good, medically tested sunblock, again, yes, is beneficial and you can use, right? Okay, next comes the second part of the question, which is whitening. Can I use whitening lotion? Ms. Cheong asked. I would not advise a patient to use whitening lotion, and I would assume that this whitening lotion most of the time is used on the face and not other area of the body. In eczema patient, we have already said that they have a natural tendency to have drier skin. So if the skin is too dry, and most of the time, if you use whitening lotions, whereby most whitening lotions, to my knowledge, has a lot of peeling agents in it, as in the sense that it increases the skin turnover. So over time, you will find that the skin becomes drier. It can make the symptom even worse. So okay, but then maybe you'll be using the whitening agent because you have some pigments on the skin or so forth. It can be treated other way, maybe even with topical agents, or perhaps sometimes there are other modalities like lasers or available, but that you may have to consult your medical doctor. I would definitely stress out here that I would not advise patients with eczema to just purchase any whitening agent off the counter and use for long term. It can have detrimental effect on your skin. Okay. Next question is from Miss Su, right? She asked, I've gone to many doctors to treat my eczema. Other than that, is there any diet that I should control? Any specific food that I should avoid? Okay. If you have Miss Su, if you have listened, I think last week we were talking about trigger factors in eczema. We know a certain group of patients, the eczema can be triggered by food. Certain food act as allergens to trigger the flare of the eczema. But there's not one hard rule or blanket cover that says all eczema patients cannot take, let's say, food A, or all eczema patients cannot take food B. But in general, we tend to see more patients in our clinics that are allergic to maybe eggs and chicken products, and some even dairy products. But I would like to stress out here that I'm not trying to say that you should avoid chicken, eggs, and dairy product altogether. Try and observe your diet and see which ones actually makes it worse. And over time, if you study it enough, you will realize yourself which one actually makes it worse. Of course, there are also tests available. There are lab tests available whereby the doctor, if you see a doctor, the doctor will take some blood samples and they send it to the lab and they test for your antibodies to those allergens. I've done personally this test. Example, I would say to foods such as crab, shrimps, peanuts, chicken, eggs, and so forth. And from there, it can actually help give you an even better idea of what you're allergic to. I will only recommend you to do it should you if you think that a lot of food actually triggers your eczema, because one of these tests is not really not say it's cheap, but it's also not too expensive. Only if you need, go see a doctor and you get it done. And of course, if you have detected that particular food that triggers the eczema, yes, you have to avoid it. But sometimes over time, this trigger can improve. But I would not recommend you to try take it for over a period of time until you get proper medical consultation. So in summary, yes, certain diet can trigger eczema. Different patients experience different triggers. There is no one blanket cover saying that everybody cannot take food A, food B, or food C. Should you need to know what exactly triggers off, there are tests available, but you need to consult a doctor first, right? Next question is from Mr. David Ng. He asked, is eczema related to asthma? Okay, yes, this is a very relevant question in the sense that we've mentioned before, eczema is a genetically linked immune disorder. It has something to do with some problems in the immune system of the body. It is linked to eczema. It is linked to asthma. Not only asthma, but there are also other things that are linked to it, such as allergic conjunctivitis, rhinitis as well. They're all part of this spectrum of immune-related illness. So sometimes we do see patients with asthma having eczema, or having more than that, like itchy eyes, snuffy nose, and things like that. Most of the time, if patients have other conditions on top of eczema, the eczema tend to be a bit worse, and they usually need more medical care than others. But management for us, eczema itself per se remains the same, even for these patients that have overlapping asthma or rhinitis. That means keep good skin moisture, and also prevent any trigger factors, right? Jennifer posted another question. Is eczema hereditary? Yes, eczema is a genetically linked condition. It is in a way, that means it is hereditary. Patients with family history, meaning let's say parents or either parents having eczema, has a higher tendency of getting eczema, but it is not full penetrance, as in some of them can escape. So yes, it is hereditary, but not everybody gets it. So it is important for you to observe your children. If you have eczema, you observe your children for eczema. And as David mentioned earlier, sometimes you also observe your children for other conditions that are related to eczema, like hay fever, allergic rhinitis, allergic conjunctivitis, or asthma, right? If you're not sure on anything, please consult with the doctor, because early confirmation of diagnosis can make a lot of difference for the child. If you control the illness earlier, any form of illness, it actually gives better result, and also improves the quality of life for the parents and also the children per se, right? Okay, another question. Last one, is it? Yes. Okay. So far this is the last question. Miss Chailing commented that will eczema spread? I just delivered my baby girl and I'm scared to touch her because I'm afraid it will spread to her. Okay. Related to the earlier question posted by Jennifer, eczema can be inherited, as in it's not really spread by touch. So of course you can touch a baby. That one I can reassure you that. And anyway, you really need to take care of your early baby. So do not avoid touching your baby. Go ahead and touch your baby. But if let's say the baby has already inherited it in the bloodstream, in the genes, there is nothing much that you can do. I would advise you to watch out for the signs of eczema on the baby's skin. And if any early signs that you see and you suspect it's eczema, consult a doctor, get a confirmation. Of course, since you mentioned that delivering, I'll comment a bit about eczema and also pregnancy. Patients in pregnancy, sometimes they can get a very atypical kind of rash around the second or third trimester that a lot of people mistaken it for eczema. Those are not. During the second and third trimester, meaning the later months of the pregnancy, they can develop a very severe itch over the abdomen, and also it can progress to being generalized. Those are not eczema. If you have that later on in pregnancy and you do not have eczema earlier in life, I would say that there's not much worry of your kid inheriting eczema. Those are a totally different condition, but of course, need to see a medical doctor to confirm it, right? So again, I would like to stress to Ms. Chiling, do not worry, eczema will not spread by touch, so you can go ahead and hold your baby, right? Anything else? That's it. Okay. So I think that will be the last question. You can still post your questions on Facebook, or you can PM Userin Malaysia, and they'll try and get back to you. They'll try and answer it as soon as possible. Again, thank you for your tuning in. Thank you for your participation. Those that have tuned in and participated, you'll be receiving a free gift worth 65 ringgit, Userin Soothing Cream, which contains 12% omega, and also the glycocalcone A to reduce the inflammation in eczema. I'll be back here again 1 month from now, and we'll be discussing another topic, also eczema related. I hope to see you then, right? Thank you.